My name is Rob Wipond. I'm an investigative journalist. During the research on my book, Your Consent is Not Required, these are the more startling, disturbing, and shocking things I learned. If you know nothing about the mental health system, there's still one story you've likely heard. The New York Times sums it up like this. After most large asylums closed decades ago, the number of state psychiatric hospital beds has plunged from 360 per 100,000 people in the 1950s to 11 beds per 100,000 people today. As a result, homeless and prison populations swelled. That's why we have to bring back asylums and forcibly hospitalize many more people for their own good. This same story, with those exact same numbers, has replayed for 2 decades in news outlets from left to right and everywhere in between. All of those news outlets cited the same key source, E. Fuller Torrey and his Treatment Advocacy Center, America's biggest billionaire-funded promoters of forced treatment. In fact, all of the available psychiatric beds were recently counted in a study by the U.S. National Association of State Mental Health Program Directors. First, they found that in the 1950s, there were really about 190 beds per 100,000 people. And that 11 per 100,000 number is only for state hospitals. It makes absolutely no sense to stop counting there. It serves the arguments of people like Torrey who are crying about bed shortages and clamoring for more funding and more forced treatment. But state hospitals represent only a fraction of available beds today. Today, we have beds for people labeled with serious mental illnesses in private psychiatric hospitals, in psychiatric wards in general hospitals, in Department of Defense and Veterans Administration hospitals, in residential treatment centers, and in long-term care facilities. Those add up to 10 times as many psychiatric inpatient beds. But that's not all of them. Then we have to count the 24/7 psychiatric beds in emergency rooms in general hospitals, in addiction treatment centers, in group homes, assisted living, and other care communities. Roughly adding these up, we actually have 600 or 700 beds per 100,000 people. 60 times as many beds. And that's many more beds than America had in the era of asylums, and in fact more than it's ever had in its history. All of which raises the question, why is no one drawing attention to these numbers, not even the state governments that funded the study? And how can America have 60 times as many beds, and yet there's still a shortage? How many people are actually being forcibly hospitalized? For answers to these and other questions, follow my videos or see my book, Your Consent is Not Required.